Can spine surgery cause paralysis? I am Dr. Hitesh Garg and I am heading the Department of Orthopedic Spine Surgery at Artemis Hospital, Gurugram. A lot of patients are living a very disabled and painful life because of spinal problems, which can be easily corrected with a very successful and safe spine surgery. But unfortunately, there are a lot of myths in our society which prevent these patients from undergoing spine surgery because they fear that spine surgery will cause paralysis. Today in this video, I would try to dispel these myths and fears. Now, the risk of paralysis in spine surgery is almost similar to the risk of a plane crashing while we are going from one place to another place, which is, we say, less than 0.01%. Now, why is this risk so less? We need to understand that our spinal column is made up of this cervical spine in the neck, mid-back or the dorsal spine, and the lower back, which is the lumbar spine. Now 70% of the spinal problems happen in the lower portion of the spine, which is the lumbar spine. Lumbar spine starts from L1, so there are 5 bones: L1, L2, L3, L4 and L5. The movement of the legs is controlled by spinal cord, which is inside this spinal column, and luckily this spinal cord ends at L1. Below L1 there is no spinal cord, there are only spinal nerves. Since 70% of the surgeries are being done on this portion of the spine where the spinal cord is not there, so the question of paralysis does not arise. So 70% of the patients who are suffering from lower back problems need not to worry that this surgery can cause paralysis because there is no spinal cord there. There are nerves, and these nerves are present throughout our body and they are collectively present here, and we take utmost care to protect these nerves when we are doing the spine surgery. Even when we are doing the spine surgery in the dorsal spine and the cervical spine, we use a lot of safety maneuvers so that no further damage happens to the spinal cord or the spinal nerves. One of the safety measures is that we do these surgeries with the help of microscope or surgical loops, which help us to see a magnified view of the spine during surgery. This image is magnified almost 3 to 10 times during surgery, which helps us to prevent any damage to the spinal nerves or the spinal cord during surgery. Another very important point is that patients often confuse spine surgery with the brain surgery. Now, in neurosurgery or in brain surgery, we take out this portion of the skull, we take out bone, and the surgery is being done on the brain. But in spine, it does not happen like that. More than 95% of the diseases affect the spinal column or the bone itself or the disc itself and does not affect the spinal cord. So we do not operate on the spinal cord. We are just operating on the bones or the discs which are surrounding the spinal cord. So we are seeing the spinal cord with the help of microscope, but we are not touching the spinal cord. We are not retracting or moving the spinal cord, or we are not going inside the spinal cord while we are doing the spine surgery, whether we are doing the surgery in the cervical spine, dorsal spine or the lumbar spine. So again, since we are not doing any surgery inside the spinal cord, the chances of paralysis are very, very less. There are only very few diseases which actually affect the spinal cord where we have to go inside the spinal cord, and in these cases definitely there is some risk of paralysis or weakness. Now third, a lot of safety measures, a lot of advancement has happened in the field of spine surgery, and one of these advancements is neuromonitoring. Now, whenever we are doing any work on the spinal cord in the dorsal spine or in the cervical spine, or we are correcting these big deformities, we do neuromonitoring where we put a lead just on the head and we put multiple leads in the arms, in all the muscles of the arms and the legs. So during the surgery, we keep running signals from the head and we pick these signals from the periphery. And if we are able to pick signals from the arms and the legs, that means the whole system of brain, spinal cord and the nerves is functioning normally. And we keep checking this when we are doing the spine surgery. Now we know that nervous tissue also is very resilient. It does not get damaged immediately. There are 4 to 6 hours before, if we reverse anything, the nervous tissue can be protected. So while doing the spine surgery, if during at any step we lose these signals, we are not able to pick the signals from the periphery, we immediately reverse our last steps and we are able to protect the spinal cord and the spinal nerves. Another advancement that has happened is that today we study the spine beforehand very closely with the help of multiple standing x-rays, flexion extension x-rays to study the alignment and the mobility of the spine. And during surgery we put screws and rods inside the spine to correct this alignment, so that our spinal column becomes, the alignment of our spinal column becomes like in any other normal person. Now the 3D imaging techniques have improved so much that with the help of advanced CA machines, OA machines, we are able to get a 3D image of these spinal models or spine and spinal implants during surgery, to ensure that our spinal implants like screws, rods, cages have been placed perfectly. They are nowhere near the nerves or the spinal cord. In some centers, even there is a facility of OAM, like at Artemis we have OAM facility where we actually are able to do almost a complete CT scan of the patient during surgery to ensure correct placement of these implants. So if we consider all these safety measures like neuromonitoring, use of microscope, and use of 3D imaging techniques, use of pre-operative detailed imaging like CT scan, MRI, we are able to give more than 99.9% safety while doing spine surgery. So I would like to give this message to all those patients who are suffering, who are living a disabled life because of spinal pain, and whose pains, nerve pains can be improved with the help of spine surgery. They should come forward and they should discuss it with their spine surgeons and get rid of these fears and myths and get this surgery done to live a wonderful pain-free life. In the end, I would like to say that if you or any of your relatives is suffering from any spine related problems, you can visit Artemis website, you can visit my personal website, or you can visit or contact Cure India to contact us so that we can dispel your fears.
If you are interested in treatment in India, please subscribe to our channel and press the bell icon to never miss a new video from us.